Alright, all you next MPs, let's jump into this presentation over derm. Let's start out by focusing on some keywords essential for recognizing dermatological conditions for your exams. Your exam might not always have a picture, so they'll give you a great description and you'll be able to recognize these keywords in the question that's going to help you determine the correct answer. So first, let's discuss lesion types. You need to familiarize yourself with terms like macule, papule, and plaque, along with specific features such as honey-crusted lesions, which are characteristic of impetigo. Next, note the color variations. Erythema signals inflammation, while pallor could indicate anemia. Understanding cyanosis, hyperpigmentation, and hypopigmentation is crucial for your assessments. Observe distribution patterns. Localized lesions may suggest conditions like contact dermatitis, while generalized symptoms could point to systemic issues. The herald patch and Christmas tree pattern are key indicators for pityriasis rosacea, helping you recognize this condition quickly. Also pay attention to associated symptoms such as pruritus and pain, which can provide clues about underlying causes. Lastly, familiarize yourself with common conditions. Psoriasis, eczema, acne, and contact dermatitis are vital to know, along with impetigo for its honey-crusted appearance and pityriasis rosea for its herald patch. Now let's take a look at the ABCDE method for melanoma screening, a crucial tool in identifying potentially dangerous skin lesions. A is for asymmetry. When assessing a mole, check to see if one half looks different from the other. Symmetrical moles are generally less concerning. B stands for border. Pay close attention to the edges of the mole. If the borders are irregular, ragged, or blurred, this is a red flag for melanoma. C is for color. A variety of colors, such as brown, black, tan, red, white, or blue, within a single mole can indicate melanoma. Uniform color is typically a sign of a benign mole. D represents diameter. Moles that are larger than 6 millimeters, or about the size of a pencil eraser, should be evaluated further, as this can be a sign of melanoma. Finally, E is for evolving. Any changes in size, shape, color, or elevation over time should prompt a visit or referral to a dermatologist. Let's take a look at actinic keratosis. It's a precancerous skin condition primarily caused by long-term sun exposure. Understanding this condition is vital because it can progress to squamous cell carcinoma if it's left untreated. So let's look at some risk factors. Individuals with significant UV exposure, whether from sunlight or tanning beds, are at a higher risk. Fair-skinned individuals, those with light hair, blue or green eyes, older adults, and those with weakened immune systems are particularly susceptible. So in terms of appearance, actinic keratosis typically manifests itself as rough, scaly patches found on sun-exposed areas like the face, ears, scalp, and hands. Color can range from pink to red or brown. Symptoms can include itching or tenderness, and while these patches may not be painful initially, they can become irritated over time. Now, treatment options are available. Common methods include cryotherapy, topical chemotherapy, photodynamic therapy, and curettage with electrosurgery. Let's take a look at basal cell carcinoma. So it originates from basal cells in the epidermis and is primarily caused by excessive UV exposure, making it a significant concern for individuals with a history of sunburn or tanning bed use. Risk factors include those with fair skin, light hair, and light eyes, as well as older adults and individuals with a family history of skin cancer. In terms of its appearance, basal cell carcinoma typically presents as a pearly or waxy bump on sun-exposed areas like the face and neck. It can also appear as flat, flesh-colored, or brown scar-like lesion, or a red irritated patch. Symptoms are usually painless, but it's important to note that these lesions may bleed, ooze, or crust over, and persistent non-healing sores should raise a concern. For treatment options, surgery is considered the most effective method, especially for lesions on the face, but other options include cryotherapy and radiation therapy for cases that cannot be surgically removed. Moving on to impetigo. So impetigo is a bacterial skin infection primarily caused by staph or strep. It often arises from minor cuts, insect bites, or other skin abrasions, making it easy for bacteria to enter. Now looking at the symptoms, impetigo typically presents with honey-crusted lesions, which are red sores or blisters that can rupture and then ooze. Patients may experience itching or discomfort, which can exacerbate the condition. Transmission. Impetigo spreads rapidly through direct contact with infected skin or contaminated objects, making it particularly common in crowded environments like schools and daycares. For treatment options, topical antibiotics like mupirocin are often effective, while oral antibiotics may be necessary for more severe cases. Additionally, good hygiene practices such as regular hand washing and avoiding close contact are crucial in preventing the spread of infection. Mupirocin ointment is a topical antibiotic primarily used to treat various skin infections, making it a go-to treatment for conditions like impetigo, folliculitis, and infected wounds. In terms of indications, it's particularly effective against bacterial infections caused by staph and strep, helping to clear infections and promote healing. It works by inhibiting bacterial protein synthesis. This action effectively disrupts the production of proteins essential for bacterial growth. It's generally advised to apply 2 to 3 times daily, and always remember to inform your patient to dry the affected area before applying to ensure optimal absorption. Regarding side effects, it's usually well tolerated, but common side effects include local irritation, redness, or itching at the application site. Although rare, some patients may experience allergic reactions or systemic absorption if used extensively. Pityriasis rosea, a common and self-limiting skin condition, often affects adolescents and young adults. It's characterized by a distinctive rash and is generally benign. The exact cause is unknown, but it may be associated with viral infections, particularly herpes viruses. However, the specific link remains unclear. In terms of appearance, the condition usually begins with a herald patch, which is a larger oval lesion that appears on the trunk. This is followed by the development of smaller oval lesions arranged in a characteristic Christmas tree pattern on the back. The rash may be mildly itchy, but is generally not painful, and most cases resolve spontaneously within 6 to 8 weeks without the need for treatment. However, topical steroids can help alleviate itching, and antihistamines may also be used for symptomatic relief. Scarlatina, commonly known as scarlet fever, a bacterial illness primarily caused by group A strep. It typically follows strep throat or skin infections and is characterized by a distinct rash that can help with diagnosis. Scarlatina arises when the bacteria produce toxins, leading to its characteristic symptoms. Symptoms include a high fever, sore throat, and headache, along with a red rash that feels like sandpaper. Another hallmark sign is the strawberry tongue, where the tongue appears red and bumpy. For diagnosis, we usually rely on clinical signs and may confirm the presence of the bacteria with a throat culture or rapid strep test. With treatment, scarlatina is effectively treated with antibiotics, typically penicillin. Alongside antibiotic therapy, symptomatic relief can be provided with fever reducers and ensuring proper hydration. Measles is a highly contagious viral infection that poses significant health risk. It's caused by the measles virus and is known for its ability to spread rapidly among unvaccinated individuals. In terms of transmission, measles spreads through respiratory droplets from coughs and sneezes. It is highly contagious, capable of remaining in the air for up to 2 hours, making it crucial to isolate infected individuals. Symptoms typically begin with a high fever, cough, runny nose, and red eyes. A notable early sign of measles is the appearance of Koplik spots, which are small white spots found inside the cheeks. Following these symptoms, a characteristic red rash usually starts on the face and spreads downward over several days. Complications from measles can be severe and include pneumonia, encephalitis, and even death, particularly in young children and those with weakened immune systems. For prevention, the MMR vaccine is highly effective at preventing measles. Moving on to mumps, a contagious viral infection that primarily affects the salivary glands. It is caused by the mumps virus and is known for its ability to spread rapidly, again, particularly in unvaccinated populations. With transmission, mumps spreads through respiratory droplets released during coughing and sneezing, as well as through direct contact with infected saliva. This makes it easy for the virus to spread in crowded environments. Symptoms typically include swelling of the parotid glands, which is noticeable in the cheek area. Other common symptoms are fever, headache, muscle aches, fatigue, and loss of appetite. Complications can be serious and can include orchitis, which is inflation of the testicles, orophyritis, inflammation of the ovaries, and even meningitis, which can have long-term effects. And again, for prevention, the MMR vaccine is highly effective in preventing mumps. Now let's take a look at varicella, commonly known as chickenpox, which is a highly contagious viral infection. It is caused by the varicella zoster virus and spreads rapidly among unvaccinated individuals. It spreads through respiratory droplets from coughs and sneezes, as well as through direct contact with the rash. It is particularly contagious from 1 to 2 days before the rash appears until all lesions have crusted over. Symptoms typically include an itchy, blister-like rash that progresses through various stages of healing. Macules appear first as flat red spots, develop into papules, which are raised bumps. Next, they'll form vesicles, small fluid-filled blisters, and then finally the lesions crust over, resulting in scabs. In addition to the rash, individuals may experience fever, fatigue, loss of appetite, and headache. Complications from varicella can be serious and may include pneumonia, encephalitis, and skin infections, particularly in individuals who are immunocompromised or have underlying health issues. For prevention, the varicella vaccine is highly effective at preventing chickenpox and its potential complications. Moving on to fifth disease, also known as erythema infectiosum, a viral infection caused by parvovirus B19. It primarily affects children and is known for its distinctive rashes and mild symptoms. It spreads through respiratory droplets released during coughing and sneezing, as well as through contact with infected blood. It is important to note that the virus can be contagious even before the rash appears. Symptoms typically include a characteristic slapped cheek rash, which is prominent in children. This is often followed by a lacy, reticular rash on the body and limbs. Other symptoms may include mild fever, headache, and fatigue. Complications are generally mild, but fifth disease can pose risk for pregnant women, potentially leading to fetal complications. It may also affect individuals with weakened immune systems or certain blood disorders. For prevention, there's no vaccine. However, practicing good hygiene like frequent hand washing and avoiding close contact with those infected can help reduce the risk of transmission. So seborrheic keratosis is a common type of benign skin growth. These growths are non-cancerous and can appear brown, black, or tan. They are often mistaken for moles or warts due to their appearance. They typically have a waxy, scaly texture and a distinctive stuck-on look. They can vary in size, ranging from a few millimeters to several centimeters. Common locations for growth include the face, chest, back, and scalp, making them a frequent finding in both women and men as they age. Symptoms are generally minimal. Most people find there's asymptomatic, but they can experience some itching or irritation, particularly if the growths are disturbed or inflamed. It is important to note they are not painful. With treatment options, they usually do not require intervention unless it's desired for cosmetic reasons or if the growths become bothersome. Removal methods include cryotherapy, curettage, and laser therapy, all of which are effective. So atopic dermatitis, commonly referred to as eczema, is a chronic inflammatory skin condition that affects many individuals, particularly children. It is a multifactorial condition influenced by genetic predisposition, environmental factors, and an abnormal immune response, making the skin more susceptible to irritation and inflammation. It is characterized by a dry, itchy skin, which can lead to red and inflamed patches. In some cases, the skin may ooze or crust, especially if scratched. Common locations include flexural areas, such as the insides of elbows and knees, as well as the face, neck, and hands. These areas are particularly vulnerable due to friction and moisture. Now, management and treatment focus on controlling symptoms and preventing flare-ups. This typically involves using moisturizers and emollients to keep the skin hydrated. Topical corticosteroids are commonly prescribed to reduce inflammation, while antihistamines can help relieve itching. It is also crucial to identify and avoid triggers, such as irritants and allergens, that can exacerbate the condition. So another type of dermatitis is contact dermatitis, which is an inflammatory skin condition that occurs when the skin comes into direct contact with an irritant or allergen. It can be classified into two main types: irritant contact dermatitis, which results from exposure to substances that physically damage the skin, such as soaps and chemicals, and allergic contact dermatitis, which is triggered by an immune response to allergens like nickel or poison ivy. Symptoms typically include redness, itching, swelling, and blistering at the site of contact. The rash is often localized to the area where the irritant or allergen touched the skin. For diagnosis, we usually just rely on medical history and physical exam. In some cases, patch testing may be conducted to identify specific allergens responsible for allergic contact dermatitis. Management and treatment focus on avoiding known irritants or allergens. Topical corticosteroids are commonly used to relieve inflammation and symptoms, while moisturizers help maintain skin hydration. Oral antihistamines may also be prescribed to help alleviate itching. Plaque psoriasis is a chronic autoimmune skin condition that affects millions of people worldwide. It's characterized by the rapid growth of skin cells, leading to thick, scaly patches that can be both uncomfortable and unsightly. It is multifactorial. It often involves genetic predisposition and immune system dysfunction, along with environmental triggers such as stress, infections, and skin injuries. Symptoms of plaque psoriasis typically include well-defined red patches covered with silvery white scales. The condition commonly affects areas such as the elbows, knees, scalp, and lower back, and can lead to itching and discomfort. For diagnosis, we usually just rely on a clinical exam and medical history. In some cases, a biopsy may be performed to confirm the diagnosis and rule out other skin conditions. Management and treatment of plaque psoriasis often involve topical treatments, including corticosteroids and vitamin D analogs, which help reduce inflammation and scaling. For moderate to severe cases, phototherapy and systemic medications may be considered. Additionally, lifestyle modifications such as regular moisturizing and stress management can help improve symptoms. Topical steroids are medications that are applied directly to the skin to reduce inflammation and modulate immune responses in localized conditions. The mechanism of action involves inhibiting inflammatory cytokines and suppress immune responses, leading to a reduction in swelling, redness, and itching associated with various skin conditions. Now, topical steroids are classified by potency. There are seven different classes. You have low potency options, which include hydrocortisone. You have medium potency agents like triamcinolone, and high potency options like betamethasone. Very high potency steroids such as clobetasol are reserved for more serious cases, and we really shouldn't even be prescribing these in primary care. Indications for use are common and include conditions like eczema, psoriasis, dermatitis, and allergic reactions. When applying topical steroids, it is important to use a thin layer on the affected area. Frequent application may vary based on the potency of the steroid and the specific condition being treated. Typically, they're applied once or twice daily. Now, with topical steroids, you want to be aware of some potential side effects, which can include skin thinning, the developmental of stretch marks, and with prolonged use, systemic absorption that may lead to adrenal suppression. Now let's move on and talk about shingles, also known as herpes zoster, which is a viral infection that affects many individuals, particularly older adults. It is caused by the reactivation of the varicella zoster virus, the same virus that causes chickenpox. After a person recovers from chickenpox, the virus remains dormant in the nervous system and can reactivate later in life. Shingles is not spread directly from person to person. However, a person with shingles can transmit the virus to someone who has never had chickenpox, leading to chickenpox in that individual. Symptoms typically include localized pain, burning, or tingling in the area where the rash will develop. This is followed by the appearance of a red rash and fluid-filled blisters, usually affecting one side of the body in a band-like distribution. Complications can arise from shingles, the most common being postherpetic neuralgia, which is persistent pain in the affected area after the rash is healed. Other potential complications include vision loss if the virus affects the eye. Now, if the eye is affected or the rash is anywhere near the eye, we're going to refer out to ophthalmology. For prevention and treatment, vaccination with Shingrix is effective in significantly reducing the risk of developing shingles. If it does occur, antiviral medications and pain management strategies are crucial for treatment and release. Antivirals are a crucial class of medication used in the treatment of viral infections. They're specifically designed to target viral infections by inhibiting various stages of the virus's life cycle, ultimately reducing viral replication and spread. In terms of mechanism of action, antivirals work by interfering with viral entry into host cells, blocking the replication processes, or preventing the release of new viral particles. Common uses for antivirals include treating infections such as the flu, HIV, herpes, shingles, and hepatitis. These medications play a vital role in managing viral diseases and improving patient outcomes. Timing is critical for antiviral effectiveness. It is generally recommended to start treatment as soon as possible, ideally within 48 hours of symptom onset for conditions like the flu and herpes. Early intervention can significantly improve outcomes. However, there are some limitations and considerations. The development of resistance can occur, making some antivirals less effective over time. Additionally, side effects can vary and must be monitored. Pediculosis refers to an infestation by lice, small parasitic insects that can inhabit the scalp, body, or pubic area. There are three main types of lice. Head lice is the most common and primarily affects the scalp. Body lice live on clothing and move to the skin to feed. Pubic lice, also known as crab lice, are typically found in the pubic area but can also appear in other coarse body hair. Lice are spread through direct head-to-head contact, sharing personal items such as combs and hats, and for pubic lice through sexual contact. Symptoms include intense itching, which is caused by an allergic reaction to lice bites. You may also see visible lice or nits attached to hair or clothing along with irritation from scratching. For treatment and prevention, over-the-counter topical insecticides like permethrin are commonly used, along with prescription treatments for more resistant cases. Regular combing and washing personal items such as bed linens and clothing are crucial to prevent reinfestation. Scabies is an infestation by mites that leads to intense itching and a characteristic rash. These mites burrow into the skin, causing irritation and an allergic reaction. Scabies spreads primarily through prolonged skin-to-skin contact. This can occur during close personal interactions, but it can also be transmitted via infested clothing or bedding. Symptoms typically include intense itching, particularly at night, and a rash characterized by red raised bumps. You may also see burrows, thin, wavy lines in the skin where the mites have burrowed. Common locations for scabies infestations include the webbing of fingers, wrists, elbows, armpits, buttocks, and genital areas. These areas are often more susceptible due to the thin skin. For treatment and prevention, the primary approach involves using topical scabicides like permethrin cream, which is applied to the entire body, from the neck down. Additionally, it is essential to wash all clothing and bedding in hot water to eliminate any remaining mites and prevent reinfestation. Permethrin is a widely used medication in the treatment of various insect infestations. It is a synthetic insecticide that is effective against pests such as scabies, mites, and head lice. Its formulation allows for safe application on the skin and hair. In terms of the mechanism of action, it works by disrupting the nervous system of insects. This disruption leads to paralysis and ultimately death, making it an effective treatment for infestations. It is commonly indicated for the treatment of scabies, head lice, and in some instances, tick bites. It is a go-to option for many healthcare providers due to its effectiveness and ease of use. It's available as a cream, lotion, or shampoo. It's typically applied topically and left on the affected area for a specific time before rinsing off, allowing the medication to work effectively. In terms of safety and side effects, it is generally considered safe with minimum side effects. Some users may experience local irritation, redness, or itching at the application site, but these reactions are usually mild. Molluscum contagiosum is a common viral skin infection that affects individuals of all ages. It's caused by a virus and is characterized by small, raised, painless bumps on the skin. In terms of transmission, it spreads primarily through direct skin-to-skin contact, although it can be transmitted via contaminated objects, such as towels, gym equipment, or clothing. Symptoms include the appearance of small, dome-shaped lesions with a dimpled center. These bumps are usually painless and skin-colored, making them often go unnoticed initially. The infection is generally harmless, but can be cosmetically concerning. Regarding treatment and management, it's often self-limited, meaning it can resolve on its own without treatment. However, for persistent cases or for cosmetic reasons, options include cryotherapy, topical therapies, and curettage. Hidradenitis suppurativa is a chronic inflammatory skin condition that can significantly impact quality of life. It is characterized by recurrent painful bumps and abscesses that occur in areas of the body with apocrine glands, such as the armpits, groin, and under the breast. In terms of causes, the exact etiology is unknown, but is believed to involve a combination of genetic, hormonal, and environmental factors. Conditions such as obesity, metabolic syndrome, and smoking have also been associated with the disease. Symptoms include painful nodules, abscesses, and the formation of tunnels or sinus tracts in affected areas. These symptoms can lead to significant discomfort and can be socially distressing. For diagnosis, we typically conduct a clinical evaluation based on the patient's medical history and physical exam. In severe cases, imaging studies may be necessary to assess the extent of the disease. Regarding treatment and management, lifestyle modifications such as weight management and smoking cessation are crucial. Topical and systemic medications, including antibiotics and biologics, may be prescribed. Surgical intervention may be considered for severe or refractory cases. Folliculitis is a common skin condition affecting the hair follicles. It's characterized by the inflammation of hair follicles, which leads to the development of red swollen bumps or pustules around the follicles. Folliculitis can arise from various factors, including bacterial infections, particularly from Staph aureus, fungal infections, irritation from shaving, or blockage of hair follicles due to dead skin or oils. Symptoms typically include small red bumps or white-headed pimples surrounding the hair follicles. Patients may also experience itching, tenderness, and sometimes pain in the affected areas. Common locations for folliculitis are those frequently subjected to friction or sweat, such as the scalp, face, arms, thighs, and buttocks. These areas are more prone to developing this condition due to increased irritation. For treatment and prevention, mild cases of folliculitis often resolve on their own. However, treatment options may include topical antibiotics or antifungals to reduce infection and inflammation. Maintaining good hygiene, avoiding tight clothing, and gentle shaving techniques can help prevent reoccurrence. So, cellulitis is an infection that affects the deeper layers of the skin and underlying tissues, leading to redness, swelling, and pain in the affected area. In terms of causes, cellulitis is most commonly caused by bacteria, particularly strep and staph. These bacteria can enter the skin through breaks, cuts, or abrasions, making it essential to keep the wounds clean and protected. Symptoms include a red, swollen, and warm area of the skin that may be painful to touch. Patients may also experience systemic symptoms such as fever, chills, and a general feeling of malaise. Common locations for cellulitis are the legs, arms, and face, although it can occur on any part of the body. Areas with existing skin conditions are those that are injured or particularly susceptible. Regarding treatment and management, cellulitis requires prompt medical attention to prevent complications. Treatments typically involve antibiotics, and in severe cases, hospitalization may be necessary for intravenous therapy. Erysipelas is a superficial bacterial infection primarily caused by Streptococcus bacteria, affecting the upper layers of skin and characterized by a distinct appearance. It often arises from breaks in the skin such as cuts, bites, surgical wounds, making proper wound care essential to prevent infection. Symptoms include a raised red area of skin that is well defined, warm to the touch, and painful. Patients may also experience systemic symptoms such as fever, chills, and malaise. Common locations include the face and lower legs, although it can occur on any part of the body. Now, to differentiate this from cellulitis, erysipelas has well-defined borders and involves the superficial layers of the skin, while cellulitis presents with diffuse swelling, redness, and deeper tissue involvement, often lacking clear borders. Regarding treatment and management, it is typically treated with antibiotics, which can effectively resolve the infection. In severe cases, hospitalization may be necessary for IV therapy and monitoring. Rosacea is a chronic skin condition. It's characterized by face redness, flushing, and the presence of visible blood vessels, primarily affecting adults, particularly those with fair skin. In terms of causes, the exact etiology of rosacea remains unknown. However, it is believed to involve a combination of genetic factors, immune system dysfunction, and environmental triggers, such as sun exposure, hot drinks, and certain foods. Symptoms include persistent facial redness, flushing, papules, and pustules that resemble acne, and in some cases, ocular symptoms such as eye irritation or dryness. Common locations affected by rosacea include the central face, particularly the cheeks, nose, forehead, and chin. This pattern of distribution is a hallmark of the condition. For treatment and management, options include topical medications as well as oral antibiotics for more severe cases. Lifestyle modifications, including avoiding known triggers and using sun protection, are also essential for managing the condition effectively. Acanthosis nigricans is a skin condition that can indicate underlying health issues. It is characterized by dark, velvety patches of skin, most often found in body folds, which can be a source of concern for those affected. It is commonly associated with insulin resistance, which can occur in conditions like type 2 diabetes and obesity. Hormonal disorders and certain medications may also contribute to its development. Symptoms include thickened and darkened skin, often with a velvety texture. In some cases, affected areas may also have an unpleasant odor, particularly in skin folds. Common locations are in body folds, including the neck, armpits, and groin, although it can also appear on the hands and face. It is primarily diagnosed through a clinical examination of the skin, and management focuses on addressing the underlying condition, which may involve lifestyle changes such as weight loss and improved diet. Topical therapies may also be used to help lighten the affected areas. Tinea is a common group of fungal infections that can affect various parts of the body. It's caused by various fungi, and these infections can be transmitted through direct skin contact as well as through contaminated surfaces like towels, gym equipment, and floors. Symptoms of tinea vary depending on the specific type of infection, but they commonly include itching, redness, and a characteristic scaly ring-like rash. This appearance is often what leads to the colloquial name ringworm. Common types of tinea include tinea corporis, which affects the body, otherwise known as ringworm, tinea pedis, known as athlete's foot, and tinea capitis, affecting the scalp. For treatment management, it is typically treated with antifungal medications, which can either be topical or systemic, depending on the severity of the infection. Additionally, prevention strategies include managing good hygiene, keeping skin dry, and avoiding contaminated surfaces. Antifungals are medications specifically designed to treat infections caused by fungi by inhibiting their growth and reproduction. In terms of types, antifungals are classified into two main categories: topical and systemic. The choice of antifungal depends on the severity and location of the infection. The mechanism of action for antifungals involves targeting various components of fungal cells, including the cell wall, membrane, or metabolic pathways. This disruption effectively halts the growth and reproduction of the fungi. Common uses include treating conditions like athlete's foot, ringworm, and candidiasis, as well as more serious systemic fungal infections that can occur in immunocompromised patients. Regarding side effects and considerations, antifungals can have side effects ranging from GI upset to more serious issues like liver toxicity or allergic reactions. Therefore, monitoring may be required, especially with systemic antifungals. Brown recluse spiders are venomous spiders primarily found in the central and southern United States. They are recognizable by their distinct violin-shaped marking on their back and their yellow-brown color. Symptoms of a bite typically begin with initial pain and redness at the bite site, which may develop into a blister or ulcer over time. In some cases, systemic symptoms like fever and chills may also occur, indicating a more severe reaction. Complications can arise from brown recluse bites, leading to necrotic lesions that may require medical intervention. Severe cases result in systemic reactions, necessitating prompt medical attention. For treatment and management, immediate wound care is essential, which includes cleaning the bite area and applying a cool compress to reduce swelling. Pain management is crucial, and in more severe cases, antibiotics may be needed, or surgical intervention may be necessary to address necrotic tissue. Now let's take a look at tick bites and their association with two significant diseases: Lyme disease and Rocky Mountain spotted fever. So ticks are ecoparasites that feed on the blood of mammals, birds, and sometimes humans. They can transmit various diseases through their bites, making awareness critical. The two common diseases we'll focus on are Lyme disease and Rocky Mountain spotted fever, both of which can lead to serious health issues. for Lyme disease is transmitted by black-legged ticks, and early signs include erythema migrans or a bullseye rash, along with fatigue, fever, and muscle aches. Treatment for Lyme disease typically involves doxycycline at a dosage of 100 milligrams twice daily for 10 to 21 days, or amoxicillin at 500 milligrams 3 times daily for 14 to 21 days, depending on the patient's age and medical history. Rocky Mountain spotted fever is transmitted by dog ticks and wood ticks, and they present with symptoms such as fever, headache, rash, and abdominal pain, usually appearing 2 to 14 days after the bite. Treatment for Rocky Mountain spotted fever involves doxycycline, typically 100 milligrams twice daily for 5 to 7 days. It is important to note that this treatment is effective even in children, as the benefits far outweigh the risks. The first step in treating a dog bite is to clean the wound thoroughly with soap and water. This is crucial for reducing the risk of infection. Dog bites can be classified as minor, moderate, or severe depending on the depth of the wound and involvement of underlying tissues. Tetanus prophylaxis is also important. If the patient's tetanus vaccine is not up to date, generally every 10 years, they should receive a tetanus shot to prevent complications. Antibiotic use should be considered for moderate to severe bites, especially if there is a puncture wound or if the dog's vaccination status is unknown. Common antibiotics include augmentin. Just remember, dog bitten equals augmentin. Anthrax primarily affects livestock, but can also infect humans, particularly those who work with animals or animal products. There are 3 main types of anthrax: cutaneous, inhalational, and gastrointestinal. Cutaneous anthrax is the most common form, occurring from skin exposure to spores. Symptoms begin as a small raised bump that resembles an insect bite. Over time, this bump progresses to a sore and ultimately develops a characteristic black necrotic eschar, which is a key diagnostic feature. Diagnosis is primarily based on clinical evaluation, supplemented by laboratory tests that confirm the presence through culture from the lesion. Treatment for anthrax lesions typically involve antibiotics, with Cipro or doxycycline being the most common choices. In severe cases, supportive care may be necessary to manage complications.